Hello, my name is Dr. J. Michael Bennett. I'm a fellowship-trained orthopedic sports medicine specialist who primarily works on minimally invasive and arthroscopic procedures of the shoulder, elbow, and knee. Today we're going to talk a little bit about distal biceps injuries. First off, from an anatomy perspective, the distal biceps is a musculotendinous structure that inserts at the base of the, or at the tuberosity of the radius. If you look at the picture here, this is a side view of the elbow. This is the radius. This little lump here is the tuberosity. And this here is the biceps muscle tendon unit inserting right on the tuberosity. So if you look at a skeletal structure here of the elbow, the biceps tendon inserts right at this tuberosity right here. So what the biceps tendon allows you to do, allows you to flex, and it allows you to supinate. Okay? Supination is the rotation of the wrist and hand. And this actually, the biceps contributes the majority of your strength with rotation. So it actually helps with when you're using a screwdriver or any kind of motion that involves rotation of the wrist and hand. That's when the biceps is primarily incorporated. Injuries of the biceps occur primarily when you have two different forces occurring at the same time. When you are reaching out and trying to grab an object, a heavy object in particular, involves supination, extension, and then flexion. You fire the muscles. So if something is falling quickly, you reach out to catch it, that involves all those movements. That, when you're not expecting it and you have any kind of tendinitis or injury to the distal biceps, can put that biceps tendon under significant stress and can lead to a tear or rupture in the biceps. So if you did have an injury like I'm describing here, and then you felt a pop or a snap or significant pain in this region here, this is called the antecubital fossa, then you may very well have a biceps injury. It usually is followed by swelling and bruising in this region. Sometimes you may even notice a deformity because as this biceps is torn, it can actually retract and coil up and actually retract upwards. And that actually causes shortening of that musculature there. And you can see a deformity if you look at your biceps and you compare it to the other side. There's an obvious deformity. Another way you can test to see if your biceps is ruptured or not, if you rotate your hand and you see the tendon or the muscle tendon unit rise and lower with rotation. If it doesn't do that, if it's doing it on one side and not on the other side, then you know that there's an injury to the biceps. So this is looking at it from the side view. This is looking at it from the front view of your elbow. So when you disrupt it from the front view, the same thing happens. It ruptures and coils and retracts, and it goes upward. Okay? Now, the key with biceps ruptures is to get it evaluated early, because these can be treated, and they can be treated surgically. The way that we surgically treat these is we pull this biceps tendon back down, and then we fixate it back to the tuberosity. Okay? The way we fixate it back to the tuberosity is with two anchors, two little anchors into the bone with stitches that run up the biceps tendon. And that gives it added support, and you tie it up top here, and it pulls that tendon back down to its normal position here on the tuberosity. The reason that we use anchors is it's because it's bone sparing. I like to leave as much bone intact as possible when we're doing a repair at the biceps tendon. Now, if you do not get these addressed early, what happens is that the muscle continues to retract and the tendon continues to retract and becomes very difficult to pull it back down. Tendons have excursion or flexibility when you pull them down. If they are retracted for long periods of time, they actually turn to scar tissue, and it can be very difficult to pull it back down. And sometimes we have to use a graft to augment the repair and actually give you a solid repair. And sometimes we have to use a cadaver graft, where we actually lay down an additional graft on top of your tendon and sew those two together to give you good fixation if we can't get that tendon back down. So we often recommend highly, if you think you have a biceps injury, to get it evaluated by an orthopedic specialist for an x-ray and possibly an MRI. And the MRI will tell us, in addition to the physical exam, whether or not you have a distal biceps injury. Go to our website at jmichaelbennett.com or orthopedicsportsdoctor.com, or feel free to call the office at 281-633-8600 for an evaluation. Thank you.